Hello, everyone. So, today I'm going to discuss the topic of depression, which is one of the most important topics in psychiatry and is fairly common in the psychiatry section of the exams. So, whenever a patient of depression presents to you, the most often presenting complaint is low mood. Okay, so the patient say, "Doctor, my mood is very low," or they can say that my energy levels are down. So, as we discussed in the previous video of the psychiatric history taking, first of all, we explore the presenting symptom. Okay, so we'll ask open-ended question about the presenting complaint. Can you please tell me a bit more about it? Okay, and let the patient tell you for a minute what the patient has been experiencing, and then you will ask about what do you think could be the cause of these symptoms. Okay, because psychiatric symptom, as I previously told you as well, present in the form of a story most of the time. So when you ask what do you think could be the cause of these symptoms, then the patient might tell you a story, okay, something that has been leading to the symptom, okay. And if the patient doesn't, then you can ask directly that any significant event that led to the development of these symptoms, or you can just ask, did anything significant happen before these symptoms started, okay? And the next part here is to ascertain the impact of these symptoms in the patient life, okay? So you will ask, how is it affecting your life, your relationship, your work, etc., okay? Then after this, we're going to ask about the associated symptoms. So in depression, we have um, basically two major symptoms and some minor symptoms. And to diagnose the depression, the patient should have at least one major symptom and some of the minor symptoms. Okay. So what are the major symptoms? So you will ask the patient, so would you say that during the last month, have you often been bothered by feeling down or hopeless? Okay. So ask a complete question like that. Okay, I want you to keep this in mind. Don't just ask, so are you feeling down? Because you have to ascertain that throughout the last month, they were most of the time down. Okay, so you'll ask, so would you say that during the last month, have you often been bothered by feeling down or hopeless? And during the last month, have you often been bothered by little interest in doing things that you used to do? So basically, feeling down and loss of interest in the hobbies are two major symptoms of depression. Then we come to the minor symptoms. So asking about the minor symptom, we should ask about the energy levels. So would you say that your energy levels are down? How is your sleep? Now regarding sleep, don't waste a lot of your time here, okay? At one time, don't like go around asking at what time do you go to sleep, at what time do you wake up, or what do you do in the evenings? Don't do that, okay? That is for insomnia. When the presenting complaint is, doctor, I can't sleep, okay? So don't waste a lot of time here. Just, we ask this question to know about what is the impact of these symptoms on the patient's sleep. Okay, and then appetite, agitation. Okay, so do you feel anxious, irritated all the time? Concentration and memory problems and guilt. Okay, so don't ask, do you feel guilty? Because everyone will be feeling guilty about some of the decisions that they made in life. Okay, that is not a diagnosis for depression. The diagnostic symptom for depression is, do you feel unreasonable guilt? Okay, that the guilt that is unreasonable, illogical. Okay, that is the symptom of depression. And the last question, but very important one, is risk of self-harm. Okay, but don't directly ask this question. I told you in the previous video as well, try to normalize sentences. So tell them that sometime when people feel really low, they can think about ending it all. Have you ever thought about this? Have you ever felt like this? Okay, so ask about the risk of self-harm. Then we come to the differential diagnosis questions. If you haven't already watched the psychiatric history taking video, then I would recommend to watch it. It will be easier for you to understand this video then. Okay, so coming to the differential, the first differential that we have on the list is hypothyroidism. Okay, because hypothyroid patient can present with symptoms resembling depression. So you will ask about, do you feel cold when other people are feeling normal, and any constipation at all? Okay. Then PTSD, which is post-traumatic stress disorder. It is one of the differentials of depression. So for this, you will ask, have you ever had any traumatizing events in your life that give you flashback and nightmares? Okay. And then for postnatal depression, Postnatal depression is one of the differentials of depression. So basically one of the forms of depression, but the management in postnatal depression is a bit different. So you'll ask about, do you have any children and any recent delivery? If they have children, then ask about any recent deliveries and ask about the time of delivery. When was the delivery? Basically ascertaining how recent was it and how is your attachment to the baby. Okay, because in postnatal depression, the patient doesn't feel any attachment to the baby and may have thoughts of harming the baby. Okay, then we come to the FAMISH, which is basically the Meftosa and Kefadix of the psychiatric history taking. So family and friends, and it's about the family and friends, who do you live with, finances, so how do you work for, what do you do for a living, and then forensics, have you ever been in trouble with the law, alcohol consumption, and any other drug consumption, medications, insight. So for insight, we ask about do you have do you think that you need any medical help with the symptoms that you are experiencing? That is basically insight. And then sleep we have already asked in the minor symptoms, so no need to ask here again. And then hallucinations. So for hallucinations, we also signpost, like it's a difficult question, so we don't ask this directly. So tell the patient that whenever people feel really, really low, they can experience some unusual things like hearing voices or seeing things that may not be there. Have you ever experienced anything like that? Okay, so we should ask about hallucinations, because in psychotic depression, the patient also experience hallucination. Then we should ask about ideas, concerns, and expectations. And then after this examination part, so examination part, we should do the vitals, GPA, we must do the BMI of the patient, okay? And the thyroid examination. The thyroid examination is must here. How we are going to explain depression to the patient? What is depression? So we'll tell the patient, from what you told me and from what I understand, it seemed like you are going through depression. Depression means feeling low and losing interest in the things that you used to do. So basically the two major symptoms of depression, feeling low and losing interest in the things that you used to do. These symptoms have severe impact on your day-to-day activities. Okay, what we are going to do, first of all, we are going to request some routine blood test, and ECG and thyroid function test. Okay, and then we come to the treatment part. Okay, so this is management. Management start with addressing ideas, concerns, and expectations and explaining the condition to the patient, while treatment only means what we are going to do for the patient. Okay, so treatment, we have three categories in treatment. First is general advice, then cognitive behavioral therapy, that is CBT, and the third one is medications. So the general advice and cognitive behavioral therapy we do for all the patients that present with depression, but medications are only reserved for the patients who have moderate to severe depression. Okay, and then there are 4 cases in which we need to refer the patient to the psychiatry. Okay, so because there is a lot of waiting time for psychiatry in the NHS, not all the patients of depression are referred to psychiatry. The GP can start antidepressant medication on their own and refer to the CBT, but there are 4 cases where we need to refer the patient to psychiatry. Okay, I will talk about these briefly, but let's first discuss what do we tell in the general advice to the patient. So general advice, I already told you, for all depression cases. So we tell the patient, start new hobbies, go out with friends, start doing exercise. You should tell the patient that exercise is really, really help in depression, like it works like a pill, okay? If patient is taking alcohol, you should tell them to cut down on the alcohol and offer support. So offer support, tell them that we can refer you to one of our clinics to help you cut down on the alcohol consumption. If the patient is struggling with childcare, you should also ask in the history about, do you have any kids, and how are you coping taking care of them? So if the patient cannot cope with childcare, then you will involve social services. Tell them that social services will support you with childcare. Okay, tell them, advise them to speak to one of their family members or friends or partners about what they're going through, because talking also really helps. Venting it out helps in depression. Okay, CBT. So CBT, again, every patient of depression we refer to CBT. We tell them that we will refer you to the psychologist for talking therapy as well. And the third one is medication. So medications are only reserved for moderate to severe cases. How would you know that whether it is mild, moderate, or severe? So when you are asking about the major symptoms and minor symptoms and impact on life, so severe patients are who have absolutely no interest in life whatsoever, feeling really down, their sleep is disturbed, their appetite is disturbed, they cannot cope with the daily life, they cannot do their daily activities. They have either they have been either fired from their jobs or they have resigned because they cannot cope and they are struggling with childcare that is affecting their relationship. So these patients are moderate to severe cases. Severe being they are also thinking about self-harm, okay? Harm to the other. Whereas mild cases are those who are only, they might be feeling down, but they are still going to the job, okay? They are still doing their job. They can do their daily activities. They have a little bit problem with sleeping. They might be a bit irritable, but their relationships are not affected. So, and they are, in general, they are still coping with their life. Okay, so those are mild cases. So for them, the general advice and the CBT, but for moderate to severe, you give the general advice, the CBT, and the medication. So all three. For medication, you need to explain that medication take time to work, at least 3 to 4 weeks. So for 3 to 4 weeks, you might not feel any improvement, but after that, you will start improving. And you should also tell them that initially, when you start the medication, they may cause a little bit of irritability and even suicidal thoughts. So I will give you a crisis card if you ever feel really irritable or you think that you might harm yourself, then please call on the number on the crisis card and someone will be there to talk to you. Okay. You need to tell them that you will need to take this medication for at least a minimum of 6 months after you feel better. Okay. So until they feel better and minimum 6 months after that is the standard therapy. Medication will be either sertraline, okay, or fluoxetine. So yeah, so now the four cases that we need to refer to the psychiatrist. The first one is self-harm, okay? Patient thinking of self-harm or harm to the others. So high risk patient, we will do immediate referral, immediate, okay, and they will be admitted even against their will. Okay, one of the times in medicine where you can admit the patient and give treatment to them against their will is patient who is a high risk self-harm or harm to the others. So self-harm, immediate referral. Psychotic symptom, immediate referral, okay, because there can be psychotic depression. So self-harm, psychotic symptom, immediate referral. Postnatal depression and resistant depression is urgent referral. Okay, so postnatal depression and resistant depression is urgent referral. Keep in mind that you cannot treat the postnatal depression patients on their own. You need to give them medications, but you need to refer them urgently to psychiatry. Okay, so that was all about depression. I will see you soon with another video. If you like this video, then please let me know in the comment section.